So we've all heard of or personally used tons of these treatments that were supposed to cure cellulite, or the creams and potions, all that kind of stuff. And unfortunately, we found that most of that stuff hasn't worked. Why is Avéli different? And believe me, I was, incredulous from the start, but it's different because it actually goes at the cause of dimple cellulite, which is these fibrous bands of tissue that pull down, mostly in women, and we'll talk about that, and cause this puckering of the fat that we see as these, dimple cellulite on the buttocks and the thighs. Cellulite is caused, especially this dimple cellulite we're talking about, by these fibrous bands of connective tissue that are pulling down in the fat layer of the skin, which causes your fat to actually then pucker out and shows those little bumps and everything that we see as dimple cellulite. This is very different than just having excess skin laxity, where your skin is just sort of rippling a bit. That's different from dimple cellulite. Now, the thing is, why do women get it so much more than men? And also, why do even thin women have cellulite? Well, it's believed that, of course, estrogen somehow is related to the number of fibrous bands there are in women that's outnumbered in men, and also kind of, the structure of them. You include that with just genetics, and again, we see that in people who are thin also, because it's really those bands that are pulling down. Doesn't matter exactly how much fat you have in general. So it's actually really simple. So this is the box that it comes in, of course, sterile, and this is just a sterile unit, but it just shows it's this small, literally just handheld device that actually, after making a little insertion point, of course, with some local anesthesia, we use this instrument to release those fibrous bands, and then therefore everything kind of pops up and makes a much more smoother surface. And you're doing this to each and every of those dimples that we identify in the buttocks and the thighs. So the ideal candidate for Avéli is anyone who has these dimple type of cellulite. Now, there are a lot of us who have both some dimples and also that sort of excess skin or just skin rippling or loose skin laxity. So that's why the consultation is so important, because once you come in, I can really pinpoint which ones are going to be treatable by the Avéli versus maybe skin laxity that we'll treat a different way. Most patients are very comfortable during the treatment process. The reason is that we actually use local anesthesia to numb all the areas, all the dimple areas that we would treated. So you really don't feel much during the treatment itself. And how long does the treatment take? It depends. It depends how many dimples that we're treating in a session. I would say when you're talking about the numbing process, you're adding that to the actual releasing of the bands. For most patients, average patients, they're looking to about 60 to 90 minutes for the treatment itself. The downtime after the Avéli procedure is actually not that bad at all. I mean, you can expect to have some swelling, which would be normal after the procedure. May have a little bruising from the little pinpoint areas that we open there for the instrument. But again, after a few weeks, most patients are looking great and starting to see those results. But in terms of, the immediate downtime, you're going right back to your activities and work and even some exercise 24 to 48 hours later. Well, the great thing about the Avéli procedure is that we're treating those dimples, and once those fibrous bands are released in that dimple, we're done. I mean, we're not repeating that in that area. So that's why it, kind of lasts very, very long lasting. Now, as we get older and weight changes, hormonal changes, of course, we can, develop new fibrous bands in other areas that we'll come and treat. But in terms of the results of the ones that have already been treated, those are good. The risks and side effects of Avéli are pretty much what you would expect, which is, some minor swelling for a while, some bruising. Sometimes people can feel like a little irregularity in the areas that are treated until they sort of smooth and soften. But in general, most patients don't really have a wide range of side effects. This is a pretty well-tolerated procedure. Yes, in fact, Avéli is often combined with other treatments. One 1-2 punch that I love is actually using Avéli, now numbing the whole buttocks and thigh area that we're working on, using Avéli to treat the dimples, and then perhaps coming back with aloe clay if there are some, hip dips or, buttocks improvement, in terms of sagging and such. So I love doing those on the same day and the same procedure because, again, we're numbing you already. So if you're going through that, we might as well take care of, most of these issues together because oftentimes people have both of those issues. In addition, you might want to think about for if you have areas like on the thighs or the back of the thighs or the buttocks where you're having that, sort of skin laxity or looseness, we can use procedures like O-therapy or microneedling with radio frequency, the Greenwich Secret, to help tighten that loose skin. So that's the great thing. Because Avéli is a targeted procedure, anything around it we can treat with other modalities. If you're interested in Avéli for dimple-type cellulite and you think that you might be a good candidate, the first thing you want to do is book a consultation with me. Reason being is, remember, I want to be able to see exactly what types of cellulite we're looking at in you personally so we can come up with a customized plan for using Avéli to treat those areas of cellulite.